So before I wanted to conclude the session, I would like to give one final try. So this stream is a one final try before we decide whether to go for a recorded one or shall we continue the same. Okay, so I'll wait for some time. I'll see if you can go through the video without any hindrance, and if at all there is no issue, we'll continue with this session, right? It's poor, but okay. It seems to be streaming at high definition here, but anyways, I can't really speak for the network. Okay, I'll just wait for a few more seconds and see. Sriparna, do help me out. If it seems to be streaming fine, then we'll continue the session, right? Yeah. Okay, Sriparna, please help me out in sharing this video link to our updates group because right now I don't have network in the other mobile, so I can't do it. So please do. Any one of you can share this live video link in others in other updates group so that the rest of them can come and join. Right? Thank you, Sriparna. Hi, Sunil. Hi, Kishore. Yes, Papia. Thank you. Thank you for the feedback. It's fine. It seems to be fine. Yeah. Okay, if any one of you is in updates, 3 updates, 2 or updates group, do share the link. We'll try to continue the discussion, right? So today, in this particular live session, we will be discussing a few multiple choice questions from dental anatomy, oral histology, as well as pharmacology, right? Hi, Javed. Yes, Sarita, finally, nature seems to be conspiring in our favor. Yes, Kishore, you can of course talk to me. You can get back through mail, proudtobedentist@gmail.com. So friends, if you are in updates or updates 2 or updates 3, do share this live link and we'll start our discussion as soon as possible, right? It seems to be streaming fine so far. It's been 3 minutes almost. Okay, Pooja, glad to hear that. Yeah, it seems to be streaming fine. Okay, we'll start with our discussion. So, yes, Sunil, we already have WhatsApp groups. It's not just one, but we have 3 groups because of saturation issues. So you can drop a mail for WhatsApp link. And also we have a Google group. We post updates in Google as well as YouTube. So we're trying to use as many platforms as possible to reach throughout, right? So very good evening, all of you. So today's live session will focus on multiple pharmacology, right? So we'll start with our first question, right? You have any queries, you can drop a mail at proudtobedentist@gmail.com. We have discussion groups, we have updates group, we have e-classes, test series, and study club discussions, right? You can get back through mail for any further queries. So once again, a very good evening. So we'll start with our first question. All of the following teeth are single rooted except options include maxillary anterior teeth, mandibular posterior teeth, maxillary second premolars, mandibular second premolars. All of the following are single rooted teeth except maxillary anteriors, mandibular posteriors, maxillary second premolars, mandibular premolars. So which of the following options would be a more appropriate answer? So Mandibular anteriors, as you know, we have single rooted teeth, as Sunil has rightly mentioned. What about the rest of the teeth? What about maxillary anterior teeth, centrals, laterals, and canines? What about mandibular posterior teeth, which include premolars as well as molars? What about maxillary second premolars and mandibular second premolars? Yes, Sriparna. So I'll repeat the question once again. All of the following teeth are single rooted except maxillary anterior teeth, mandibular posterior teeth, maxillary second premolars, mandibular premolars. Yes, even in case of mandibular premolars, second premolar or first premolar, it is only single rooted. Maxillary second premolar is also single rooted, but maxillary first premolar, as you know, we have buccal and palatal roots. Maxillary anteriors, as you know, centrals, laterals, and canines, they are single rooted. But mandibular posterior teeth includes premolars as well as molars. So this would be more appropriate answer. As you know, in case of mandibular molars, first molar or second molar, we have two roots, mesial as well as distal. Good Papia. Right. So all of the following teeth are single rooted except. So option B, mandibular posterior teeth, would be more appropriate answer. Now, another important question pertaining to size of the pulp chamber in comparison with apical foramen. During root development, the size of pulp chamber is larger than apical foramen, smaller than apical foramen, equal in size. No comparison can be made as there is no information in literature. So which of the following options would you choose? I'll repeat the question. During root development, the size of pulp chamber is larger than apical foramen, smaller than apical foramen, equal in size. No comparison can be made as there is no information in literature. So usually the size of pulp chamber, as most of you are rightly mentioning, it is larger than the size of apical foramen in a normal adult tooth. But the question carries an important word, during root development. The question states, during root development, the size of pulp chamber is. So during developmental stages, the apical foramen is larger than the pulp chamber. This is very, very important. As we all know, pulp chamber is larger than apical foramen in case of adult teeth, isn't it? Because of continuous deposition of dentin, the apical foramen becomes narrower and narrower. But during root development stage, the size of pulp chamber is option B, smaller than the apical foramen, right? So this is very important. Don't get confused, right? I hope it's clear. So option B would be more appropriate answer. Now, it's not a soup kind of question, but you yourself have created a soup and you have fell into it, Sarita. Okay, now let's move on to the next question. You all like caffeine, right? Caffeine. So where do you think caffeine is present in our food products? Can Yeah, yes, Sarita, caffeine is present. What else are the sources of caffeine? Cool drinks, good. Coca-Cola, soft drinks, skin. I'm talking about food sources, Sunil. Yes, coffee, soft drinks, even in tea we have caffeine, isn't it? Yeah, even in tea. And what about chocolates? Yeah, coffee, tea, soft drinks, as well as even chocolates. Cocoa containing, right? Green tea, maybe, to some extent. Okay, the question is, caffeine is present in highest quantity in which of the following options? I'll repeat the question. Caffeine is present in highest quantity in which of the following? Cup of cocoa, 200 ml of Coca-Cola, an average sized cup of coffee, an average sized cup of tea. So among the four options, which one do you think has more content of caffeine? Caffeine is present in highest quantity in which of the following? Cup of cocoa, 200 ml of Coca-Cola, average cup of coffee, average cup of tea. Average is size. So obviously, as Kritiga, Sarita, Kishore, Papiya, Sriparna, yes, Sunil, it's coffee. Coffee is the right answer. So average cup of coffee, right? It contains around 75 milligrams of caffeine, whereas average cup of tea contains around 50 milligrams of caffeine, and an average cup of cocoa contains 4 milligrams of caffeine, right? You can just make a note of these values. And a 200 ml bottle of soft drink, Coca-Cola, contains 30 milligrams of caffeine, right? So cup of cocoa, option A, as you can see. So I'm really sorry, you can't see, right? I mean, if it were a recorded video, I could have projected the image. Anyways, average cup of tea, 50 milligrams of caffeine. Average cup of coffee, 75 milligrams of caffeine. And cup of cocoa, 4 milligrams. 200 ml bottle of Coca-Cola, 30 milligrams. So coffee, as most of you rightly mentioned, is the right answer. Okay, let's move on to the next question. All of the following are disadvantages of parenteral route except. So we have different routes, right? Oral, parenteral, right? So all of the following are disadvantages of parenteral route except pain, local tissue injury, liver is bypassed, costlier. So among these four options, which one do you think is the exception? I'll repeat the question. All of the following are disadvantages of parenteral route except pain, local tissue injury, liver is bypassed, costlier. All of the following are disadvantages of parenteral route except. Don't you think parenteral route medicines are costlier compared to oral route? See, we have several disadvantages with parenteral route. Psychological issues because of needle prick, potential local tissue injury, and when you compare these drugs with oral counterparts, parenteral preparations are far more costlier. Just try to compare any drug, for example, you'll have an idea. So, pain, local tissue injury, and costlier, these factors are disadvantages of parenteral route, but because in oral route, first pass metabolism, as you all know, right? But in case of parenteral route, this can be avoided as the liver is bypassed. So option C is right answer. Liver can't be bypassed. Taranita, you need to check the literature once again. Bhavna, bingo. Yes, Ajman, you're right. So local tissue injury is a disadvantage of parenteral route, right? I hope it's clear. So all of the following are disadvantages of parenteral route except pain, local tissue injury, liver bypassed, costlier. It's option C. Now let's move on to the next question. Why do we use combined or combination of antimicrobials? What's the rationale behind use of combination of antibiotics or antimicrobials? So a next question based on that. Combined use of antimicrobials has one of the following advantages: synergism, minimize adverse effects, prevent resistance, broaden spectrum of activity. So among these, which one do you think is the advantage of combined use of antimicrobials? I'll repeat the question once again. See, because of connectivity issues, I'm not even able to type the question in the live chat using my laptop because I don't have any other source of internet, and my mobile data cannot be tethered to laptop. If I do that, the connection seems to be very, very poor, and the live seems to be interfering, right? So I'll try to repeat the question once again. Combined use of antimicrobials has one of the following advantages: synergism, minimize adverse effects, prevent resistance, broaden spectrum of activity. So your dentist has chosen option A. Sunil says option D. Tirtha option A. So most of you are going with option D. Kishore says, sorry sir, I can't join now because of network problems. Okay, Kishore. Avantika says all. Arijit, Kirdiga, Priyanka, Himanshi says C and D. Okay, see, combined use of antimicrobials has the following advantages. The reason why we're medicine, if 1 + 1 is equal to 3, only then we go for combined use of antimicrobials, which is nothing but synergism, isn't it? So synergism, take for example drugs which are used for treating tuberculosis, isoniazid and rifampin. As you know, we use combination of drugs, right, because of synergism. So option A is right, is advantage. And option B, minimize adverse effects. Another advantage we have with combined use of antimicrobials is the doses of the individual drug can be reduced, because as we are obtaining synergism by using 2 drugs, so the individual doses of a particular drug can be reduced, thereby minimizing toxic or adverse effects. The best example is streptomycin and penicillin used in combination for treating subacute bacterial endocarditis due to streptococcal fecalis infection, right? So even option B is the advantage we have with combined use of antimicrobials. Option C, prevent resistance. While treating chronic infections, especially chronic infections like tuberculosis or leprosy, we need to use a particular drug for a greater or longer duration, so there can be chance for development of resistance. So in order to prevent this resistance, combination of drugs can be used, right, to confuse the microorganisms. So even option C is right. And finally, broad spectrum of activity. So one particular drug has a specific spectrum, the other has another specific spectrum. So when you combine both, obviously there will be broadening of spectrum, antimicrobial activity, right? So all of the options are true and are advantages pertaining to the combination of antimicrobials which are being used. So combined use of antimicrobials has all of the following advantages, as Avantika and few of you rightly mentioned. Okay, so all of the above. So remember, our questions do not just contain a single best response tag. So there will be different kinds of questions where you might find more than one right answer among the given options. Okay, now we'll move on to the next question. Yeah, pertaining to dental anatomy again. All teeth except molars. See, this is a very easy question. I'm sure 100% of you would be giving right answer. All teeth except molars are considered as anterior teeth, posterior teeth, both, intermediate teeth. So which option would you choose? I'll repeat the question. All teeth except molars are considered as anterior teeth, posterior teeth, both, intermediate teeth. Light seems to be failing. All teeth except molars are considered as anterior, posterior, both, intermediate. So which of the following options is more appropriate answer? I see some of you selecting anterior. Ramya says anterior, Sunil says anterior, Nida, Priya, Rakshita, Tirtha. Okay, all of you are giving both. Yes, Sandeep, yes, Tara Lakshmi. It's both. See, it seems to be a very simple question, but we should be very careful while answering, because no question is simple if you are not going through it properly, right? So do go through the question not once but twice. So all teeth except molars are considered as. So except molars you have anteriors like centrals, laterals and canines, and also you have premolars, right? So option C, both, would be a more appropriate answer. See, if I ask you name anteriors, name posteriors, it will be easy for you to answer. But it's all about a way of questioning. See, remember, subject is going to be very simple. Since you are already learning right from first year, you can easily understand the concepts and you can easily remember. The problem lies in trying to understand the question. Once you understand the question, once you go through the question not once but twice, you will definitely answer no matter how complex the question is, right? I hope you got my point. Now, to next question. We still have 2 more questions and then we'll conclude the session. We have 2 statements. Statement 1, alkaline phosphate hydrolyzes 1 second. Yeah. Statement 1, alkaline phosphate hydrolyzes inorganic phosphate. Statement 2, alkaline phosphate is used as a marker of active tissue mineralization. So we have 2 statements. Let me know whether these 2 statements are true or false. Statement 1, alkaline phosphate alkaline phosphate hydrolyzes inorganic phosphate. Statement 2, alkaline phosphate is used as a marker of active tissue mineralization. So let me know whether both statements are true or false. Okay, Ali says statement 1 is false. Rakshita says statement 2 is true. Lakshmi also says statement 1 is false. Sunil says difficult one. Okay, Sunil. See, no question is difficult if you know the concept. Once you are thorough with the concept, it will be easy. And that's what we should focus on during our preparation. Try to master as many concepts as we can. Good. So first statement is false, second statement is true, as most of you have rightly mentioned. So alkaline phosphate in fact is used as a marker of active tissue mineralization because alkaline phosphatase provides inorganic phosphates for formation of hydroxyapatite crystals. Keep that in mind. And also remember, alkaline phosphatase hydrolyzes organic phosphate to form various inorganic phosphates, but it doesn't hydrolyze inorganic phosphate as such. Alkaline phosphatase hydrolyzes inorganic pyrophosphate. It's not inorganic phosphate, it is inorganic pyrophosphate. So if statement 1 is like alkaline phosphatase hydrolyzes inorganic pyrophosphate, that would have been the right answer, the right statement, okay? I think I mentioned alkaline phosphate in the question, right? It's not alkaline phosphate, it's alkaline phosphatase. We're talking about alkaline phosphatase enzyme. So the bottom line is alkaline phosphatase hydrolyzes organic phosphates to form inorganic phosphates which are useful for forming hydroxyapatites. Hence, alkaline phosphatase is used as a marker of active tissue mineralization, which is obviously understood. And also remember that alkaline phosphatase hydrolyzes inorganic pyrophosphate. This inorganic pyrophosphate is an inhibitor of hydroxyapatite formation, right? So the bottom line here is alkaline phosphatase promotes mineralization. Hence, it is used as a marker for analyzing the amount of mineralization that's happening in a particular tissue, right? So I hope I have given you ample clarity, and if you need further clarification, do let me know. So this will be our penultimate question, and we have just one more question. Alkaline phosphatase is considered or is seen as a marker, is measured in order to analyze the amount of mineralization because of the fact that it's promoting hydroxyapatite crystals formation. By hydrolyzing organic phosphates, as a result, they are broken down into inorganic phosphates. Also, alkaline phosphatase hydrolyzes inorganic pyrophosphatase, which is responsible for inhibiting hydroxyapatite. So just 2 important points pertaining to alkaline phosphatase. I hope it's clear, right? If you need further clarification, do let me know. I'll try to again repeat the same. Now, we have one final question. Match the following. I mean, this is more easy to answer if at all I post it in the form of a text, but unfortunately, because of the given scenario, I can only recite the columns in the match the following. See, try answering them as much as you can. Yes, definitely, Sarita, I will. I'll even give you some geographical points pertaining to this particular area. So match the following, we have 2 columns. One column you have protection, digestion, deglutition, antimicrobial action, phonation. On the other side of the column, you have mucin, IgA, water, amylase. So you have two columns here. I actually wanted you to match them. 1 second. Is it still streaming? It's gone again. It is live. I think there seems to be signal as we can. Okay, we have two columns. First column, protection, digestion, deglutition, antimicrobial action, phonation. The other column you have mucin, IgA, water, amylase. Protection, digestion, deglutition, antimicrobial action, phonation, mucin, IgA, water, and amylase. So you can answer antimicrobial action for sure. Antimicrobial action, it's obviously IgA, good. Digestion, salivary amylase, good. And what about phonation? What about phonation? Yes, for protection, as Ali rightly said, it's mucin as well as water. Yes, mucin helps in protection as well as digestion. See, there is a difference between protection and antimicrobial action. Don't get confused. And see, protection is a general term which can be used for defense mechanisms. But here we have a specific term, antimicrobial action. Yes, phonation, mucin, and water. So it's very simple. So you answered two main things, right? So antimicrobial action, IgA, digestion, amylase, protection, deglutition, phonation. So all of these have mucin and water in common. Exactly. That's right. So I'll repeat the question once again. So protection, mucin as well as water, digestion, amylase, deglutition, it's again both mucin and water, antimicrobial action, IgA, phonation, ability to talk, again it's mucin and water, right? So I'll summarize all that we have discussed so far so that those who have joined the session late can have an overview of what we have discussed, and then we'll have a look at the beautiful landscapes waiting in the backdrop. Yes, Priya, very good. So we'll start with the first question. So combined use of antimicrobials has the following advantages. It's synergism, to minimize adverse effects, to prevent resistance, and to have enhanced or broadened spectrum of activity. Second question, all of the following are disadvantages of parenteral route except. So pain, local tissue injury, and cost factor are disadvantages with parenteral route, but bypassing liver is the advantage we have with parenteral route, unlike oral route, right? Now, caffeine is present in highest quantity in which of the following? Cup of cocoa, 200 ml of Coca-Cola, cup of coffee, cup of tea. Obviously, coffee contains greater amount of caffeine comparatively, right? So 200 ml bottle of Coca-Cola contains 30 milligrams of caffeine. A cup of cocoa contains 4 milligrams of caffeine. Cup of coffee contains 75 milligrams of caffeine, and tea contains around 50 milligrams of caffeine. Next, during root development, the size of pulp chamber is, see, conventionally in a fully formed tooth or teeth, the size of pulp chamber is larger than apical foramen, but during root development, the size of apical foramen is larger than the pulp chamber. You might have heard of blunderbuss canals, right? Just observe some radiographs in case of young permanent tooth. You will find larger canals and larger apical foramen, right? And all of the following teeth are single rooted except, so it's very simple, as you know, in case of maxillary anteriors we have single rooted teeth. In case of mandibular posteriors, premolars have single roots, molars have two roots. And also we have something called radix entomolaris and paramolaris. So if anyone is interested, do come back through mail, we'll discuss the same. Radix entomolaris, radix paramolaris. I even posted the same in our E-classes videos. I mean endodontic section, I reckon. So in case of maxillary second premolars, it's also single rooted teeth. Maxillary first premolar, two roots, buccal and lingual. Mandibular premolars, as you know, single rooted. Next question, all teeth except molars are considered as. anteriors, posteriors, both intermediate. So all teeth except molars includes centrals, laterals, canines, and premolars. So it's both anterior as well as posterior. Now, a penultimate question. Statement 1, alkaline phosphatase hydrolyzes inorganic phosphate. It's a false statement because alkaline phosphatase hydrolyzes inorganic pyrophosphate. Statement 2, alkaline phosphatase is used as a marker of active tissue mineralization. It's a true statement because alkaline phosphatase promotes formation of inorganic phosphates and then thereby promoting hydroxyapatite crystal formation. And also alkaline phosphatase hydrolyzes inorganic pyrophosphate, which is an inhibitor of hydroxyapatite formation. And final question, we have matched the following based on the salivary components and their functions. As you all rightly mentioned, so defense mechanism or antimicrobial activity is by antibodies, IgM, IgA in specific secretory. And mucin and water play an important role in protection, digestion, deglutition as well as phonation. And digestion in specific, we have enzymes in saliva such as salivary amylase, right? So these are some of the questions which I wanted to highlight in this specific video, and I'm really sorry because of internet issues I couldn't connect my laptop. If I had connected to my laptop, I would have given all of these questions in the form of text messages in live chat. Anyways, I'm really glad that you have actively involved in today's discussion, and before we conclude, I'll just show you some landscapes in the backdrop with beautiful Himalayas. And the reason why, in spite of having a poor network connectivity, I had this live session is because, as I promised, we'll have one live session, at least one live session every week for sake of facilitating interaction, right? Okay, so we'll just go to the backdrop and we'll check it out, how it is out there. Ready? Sarita. Hi, Ian. Glad to hear that. Neha, no, I'm not for sake of vacations. Actually, both. Usually every year, my leg seems to be partially paralyzed. Just give me 2 seconds. See, Neha, like every year, I have decided to travel to at least 2 or 3 countries because the work which I do can be done from any part of the world. So if I keep on moving places, right, so I'll have an opportunity to record videos, to provide recorded videos to you in e-classes with different possible locations, and also moving to different places refreshes and gives you new enthusiasm, new source of energy. That's the reason why I personally made it mandatory that I should be traveling at least 2 or 3 countries every year. That's the reason why I frequently travel to not many places based on time availability as much as I can. And so the answer to your specific question, it's like both vacation as well as work. So it's combined, it's hybrid. It's not that I have to work somewhere and I have to go for vacation elsewhere. It's a fusion, it's a hybrid of both. Hi Selva, glad that you joined us live. Ian, you are second PUC student and a subscriber of yours. Glad to hear that, Ian. So we'll just go to that particular direction, but I don't think it's really visible because of clouds and all. See, morning we had a tremendous view of the Annapurna Himalayan range, and it was just amazing. Hi Lakshmi, glad to hear that. We'll see if we can catch out something out there. Orientation seems to be locked, so I can't show you in landscape. So we have a small village here. Right now I am in a place which is 200 kilometers from Kathmandu. Right? It comes or it falls under Pokhara. So we have Himalayan mountains there. I mean, back there what you see, they're mountains but not snow-capped. But behind them, clouds seems to be obscuring the vision. But behind them there are Annapurna range of mountains. We have Annapurna Dakshin mountain way back there. It's not so clear. with an altitude of 7,200 meters. And we have Macha Puchara. I'm not exactly sure of the pronunciation. Macha Puchara, I think. Macha Puchara, which has an altitude of around 6,900 meters. Morning, it was splendid. Don't worry. I have done lot many recorded videos with this backdrop, so I'll definitely project the same in our recorded videos and we'll post them in YouTube as well as in our e-classes. So just have a look. So it's very cloudy. Maybe that's the reason why you're not able to make out the snow-capped mountains. But when it is very sunny, when you have a blue sky and bright sun, and you're going to have those purely white snow appearance, right? Snow-capped mountains, which is going to be just amazing. So right now, unfortunately, even 1 hour before, the snow-capped mountains were clearly visible. But unfortunately now, I don't think they are visible. You'll find Annapurna Dakshin almost at the tip of my finger. It is almost still here. So because of clouds and all, it seems to be obscuring the vision, but the peak lies somewhere in this area where I'm pointing out my finger approximately. It has an altitude of 7,200 meters. Just amazing to watch, especially when you have clear sky, blue sky, and bright sunny day. It's going to be just amazing. Snow-capped mountains, they just add beauty and they give you a lot of inner peace. It's a must experience. And as I said, we are in a place which is 200 kilometers from Kathmandu, called as Pokhara. It falls under north-central Nepal. And this is a place where we are right now staying. So you have greenery all over. And we have a small village back there. And unfortunately, we couldn't have the view of mountains, snow-capped mountains, because of cloud issues. Anyways, I'm glad we had a live session. We had a live session, uninterrupted live session, isn't it? So as I said, we have 3 peaks which are visible from this particular place, called Annapurna Dakshin, Macha Puchare, and Lamsang Kailas. Macha Puchare, it's not allowed for trekking and all because it's considered as a place of Shiva. So we have Annapurna Dakshin, which has an altitude of 7,200 meters. I pointed out my finger way back there, right? I'll show you in recorded videos. And it was first ascended way back in 1964. It has an altitude of 7,200 meters. It is 101st highest mountain in the world. And we even have Everest here, right? So Nepal, it's definitely an amazing place. Even though it's summer. I mean, way back in India, it's very hot and humid. But of course, we have definitely wonderful places in India as well. India is a subcontinent, right? But the climate here is really amazing. It has been raining the whole day. Temperatures are in the range of 15 to 25 degrees centigrade, and you definitely need a jacket to protect yourself from the extreme climatic situations here. So Priya says ready. Okay. Hi Nishu, very good evening. Dr. Selva,